just an image that I think I will never forget in my life is just me lying on the floor of the bathroom in a pool of my own vomit and urine and blood, unable to move for a good 45-50 minutes and sweating, and my mom's there to able to do absolutely nothing. And I would just pray for, I don't know, I would pray to any and every god in heaven and hell to just make it stop, just do anything but make it stop. That's how bad my pain was.
So in medical field, the gold standard for diagnosis is the laparoscopy, which is actually an invasive surgery. So we have to go inside the tummy and visualize all the parts of the tummy to see where there are endometriotic patches or not. So on an average, it takes around 7 to 8 years, they say, for a woman to be diagnosed with endometriosis. The first thing is we have to listen to the woman.
Welcome to Berry Naari with your podcast hosts Saraswati and Aditi. One, a chai-loving engineer from Bangalore, and the other, a beer-sipping economist in Berlin. Join us and our expert guests as we enter the vibrant world of Indian women through the power of data and stories.
Hello, hi everyone. Welcome to a new episode of Berry Naari. Today we have quite a new format of Berry Naari podcast, which we are super excited about. Just to give you an idea why we came up with this new format is for two reasons. One is we really wanted to bring out women who have lived experience of any women's health condition and who are already sharing their conversation, breaking the stigma, being out there. We love that. We are so inspired by them, and we really want to bring them to many more of you. And then the second thing is also we really want to open up the conversation between us, the women, and the healthcare system. And that's through our doctors and our gynecologists we work with, who are also amazing people who want to, increase their impact. And so, yeah, we are really looking forward to doing these things. And for the first episode, we are very privileged to have Medha and Dr.Sravanthi with us. We'll be talking about Medha's lived experience of endometriosis. So maybe a lot of you have not heard of endometriosis, and I hadn't, frankly, till a few years ago. And I just have a friend who has been diagnosed with it recently, and I just always remember her talking about that, during her period, she would just lie in her bed and she never had the idea of whether this is quote unquote normal pain or if it is any other kind of a pain. And for me, that was just like something unbelievable always. I think I find it so hard to, I think, feel and empathize in a way because it's, so happy to have Medha sharing her story today.
Welcome Medha and welcome Dr. Shravanthi. I am, like I shared, I was personally very curious to learn more about endometriosis. I think I can personally remember friends from my college who, like you shared, used to experience debilitating pain, could not get up, could not get to classes, and then eventually got diagnosis like many years later. And now we've read that it almost takes 8 years for a diagnosis to happen, which is insane. So I'm so glad. Again, thank you so much, Medha, for sharing the story with us and with many other women who will just help them recognize their own symptoms better. And thanks so much to Dr. Shravanthi for working with Cranberry. Dr. Shravanthi is a part of our expert panel at Cranberry who continues to guide us so that we build the right solutions for women health. And she's also here to explain the medical side of what really goes on with the condition and its treatment and so on. So I would like for both of you to introduce yourself, maybe Medha and then Dr. Shravanthi.
Yeah, hi Aditi, Saraswati, and Dr. Shravanthi. I am Medha. Thank you so much, first of all, for having me for this podcast. I really love the work that you're doing through the podcast Very Nari, and overall what Cranberry is doing in terms of women's healthcare and trying to achieve for them. It's really an honor to be called for a podcast to come and talk about endometriosis as someone who underwent surgery for endometriosis just 2 years back. I think one of the very interesting things that I was also sharing with y'all just, you know, a little bit earlier was that the first time that I came to know about anything such as endometriosis existing was through a podcast.
Mm-hmm.
And this was
Yeah.
around 2.5 years back. So today, the fact that I am doing a podcast makes me feel like I've come a whole circle from there. So I'm very humbled more than excited to be able to share my experience, and yeah, just hope that I'm able to do for others what I was able to receive from other women in terms of the knowledge of endometriosis. So yeah, thank you.
Oh, beautiful.
So, hi guys. So, hi Aditi, hi Saraswati, and very nice to meet you, Medha. And I think this is the first time I'm a part of such a kind of great conversation, like where the doctor and the person who has experience are kind of interacting. I really love the format. So, I think we can come up with good what I would say good output through this communication. So I'm Dr. Sravanthi. So I'm a oncologist by profession. So but my interest is in general gynecology also as well. So I'm working with these guys. I'm really excited to be a part of their journey and helping them out.
Thank you so much,
Yeah.
both of you, for these wonderful introductions. And yeah, so I think a great place to start with would be like just uh, Dr. Shavanti, if you can like say yours too, like what is endometriosis and why is it caused, or whatever we know about it in terms of science. That would be great.
Yeah. So, to begin with, I think first of all, we have to understand that we have the uterus and ovaries as the reproductive organs, and cervix and the vagina, right? So, uterus is lined by a thin layer of cells or tissues, which we call in medical terms as endometrium. So, normally the location of it is only inside the uterine cavity. But in certain individuals, what happens is we have a similar kind of tissue in other parts of our body as well, like inside our tummy or maybe on the ovaries or fallopian tubes. Sometimes even in remote locations, also sometimes at the scars as well. So, what happens is normally the lining of our uterus responds to the hormones which our ovaries produce. So, when we are
Mm-hmm.
going through the menstrual cycle, so once the ovulation happens, there are the lining of the uterus thickens up, so that if pregnancy happens, it can support it. But if the pregnancy doesn't occur, the lining gets shed off due to the fall in the hormonal levels. Now, normally when we menstruate, this lining is what is shedding out from the uterus through the vagina, and we have the menstrual bleeding, right? But if a person has similar kind of tissue at the other locations, these are also going to respond to the ovarian hormones which we have during our reproductive age group. So what happens is this kind of bleeding, similar bleeding happens in these tissues also. So like if somebody has ovarian endometriosis where similar kind of tissue is located, they tend to bleed there and form cysts, which we commonly call as chocolate cyst, like in layman terms, or endometriomas. And not just the cyst, this is one part of the presentation. There could be just deposits of these tissues which may not be identified through general imaging techniques. Okay, so the thing is that many a times it is not just based on imaging that we can diagnose this condition. So that is the reason why the diagnosis takes a little longer time. So in medical field, the gold standard for diagnosis is the laparoscopy, which is actually an invasive surgery. So we have to go inside the tummy and visualize all the parts of the tummy to see where there are endometriotic patches or not, right? So on an average, it takes around 7 to 8 years, they say, for a woman to be diagnosed with endometriosis. But in the coming years there is lots of awareness, obviously even the medical field is also a little more sensitized now to take
Mm.
treat the individuals who have endometriosis. And I think the awareness is reaching out even to general public. Like before I got into the medical school, it was only once I started doing my PG, or maybe in the final year gynecology, I heard about this condition. Now I think even other people probably must be knowing, definitely, I'm sure, given the new age internet age. So this is more or less about endometriosis. And if we see about the symptoms, so the symptoms will be more commonly, the most common symptoms would be the pain during menstrual cycles. So general thing what we all consider as a women is that the menses are supposed to be painful, especially like we are primed that way,
Yeah.
but that is not so, right? So any menstrual pain which is hampering our lifestyle, that is not normal. So some amount of menstrual cramps do happen on initial days, but the pain which is
Mhm.
associated with endometriosis, it can be debilitating. It can hamper your school activity, especially in young teenage girls, or your work life as well. Okay, some people cannot even get out of
Mhm.
their bed. Even the medications, the antispasmodics what they take, they do not help. So such kind of a pain is something which points you that this is not normal, so you have to talk to your healthcare provider and get it evaluated. So the
Mhm.
pain can be cyclic as well, or sometimes in very severe endometriosis it can be persistent as well throughout the cycle. Once the disease or the
Wow.
condition has progressed so much, the women can experience pain throughout their menstrual cycle, I mean not just during their periods. And they may
Mhm.
present as chronic pelvic pain as well. And many a
Yeah.
times we don't see any other reason, other things are ruled out, then probably what we are left with is endometriosis. And yeah,
Mm.
there can be other conditions as well, like other symptoms as well, I would say. Like some women with very severe endometriosis may even have pain during while passing urine, or sometimes while passing stools as well. And
Mhm.
even painful intercourse, sexual intercourse is also one of the symptoms. So and they usually do have problem with conceiving as well. So these are all the kind of the clinical pictures what we see in women presenting with endometriosis. Yeah.
Thanks a lot for that micro biology lesson right now. Yeah, I think one of the questions I always kept asking when I started the company was, oh, the uterus is the womb, right? So I don't know if any of our
Yes.
listeners will also have that question like me. uh, so, uh, yeah, that's very insightful. Thanks a lot for sharing. I think you connect well to Medha, you sharing your journey. Like we want to hear from the start. Like what was your experience through all the misconceptions you knew about period pain is normal and how you led to your diagnosis.
Yeah, I think Dr. Shravanthi has summed up what endometriosis is and how it presents itself so well. So, when it came to my own personal experience, um, actually, most conversations when it comes to endometriosis almost always has to start with pain, right? Given that it is one of the 20 most painful diseases there are, like NHS UK has declared endometriosis to be the top 20 most painful conditions.
Wow,
When
out
I
of
was growing
all,
up,
not just women's health, like all
not
conditions.
just women's health, out of all.
Okay.
Yeah.
Mm.
Um, but yeah, like Dr. Shravanti said, most people don't think of it like that. We all grow up thinking that a certain amount of period pain is normal, and it's completely okay for you to be dealing with it. It's completely okay for some women to experience a little pain more than the others, and there are all sorts of, I mean, today I will call them excuses only because I do think of them as excuses that are given for this, right? Which is, maybe your mom had painful periods, that's why you do. Maybe you don't eat
Mhm.
well, that's why you have painful periods. You don't take enough supplements, so you have painful periods. I mean, there's all sorts of reasons, but हाँ ठीक है, painful periods is what you have, and that's a reality. Surprisingly, with me, when I started menstruating at the age of 12 years, I didn't
Mm.
start off having painful periods. I was a district level basketball player in school, and there were times when I had my period and I was playing basketball and I wouldn't know. What I did have from when I was, from when I started menstruating was very, very heavy bleeding.
Okay.
It did not necessarily correlate with pain until and unless, I was 17 and 18. I started going to college. I had a lot of travel to do for my college. It was 15 kilometers away. I had to take buses, change two buses, and walk a considerable amount of distance. And in general, I started feeling a lot more fatigue at that time. And I remember that was around the first few times when we considered going to a gynecologist for my period related issues ever since the first time. So, when I first started menstruating, I was anemic, and that was the only reason we'd gone to the gynecologist for the heavy bleeding, which very soon subsided, was under control. I used bigger pads, bigger sanitary napkins, and then after the age of 12, 13, I think it was around when I was 18 and 19, and I started this college routine of mine where the pain had reached a considerable level where I thought that, I'm not sure, is it okay to take medicines, because there's so much
Mm.
stigma around even taking medicines to control your periods,
Yeah.
that even that feels like, are is this okay? Other women are not using medicines. Why?
Am I weak? You
Yeah.
know?
Yeah, yeah.
This is the
Uh,
first question that we get when we go and do workshops. Like we talk about menstrual health, awareness, how cycle changes over time. Like 45-minute presentation, first question at the end of it, is it okay to take painkillers? Like when you have menstrual pain,
yes,
when you have severe pain, like so
exactly,
yeah.
exactly. At each stage you will realize, and it's only retrospectively that I realize that today, right? But at that time, just such a small step. Today I'm like, although this will not be advertised, but I now take like painkillers, like, well, I'll not say candy, but I do take painkillers quite often. I do need them. I need them to survive my daily life. But at that time,
Mm.
such a small thing was also felt so big, and that was despite the fact that my mom's a biology teacher, and we've never had to sort of, for smaller things, we've never always had to sort of reach out to a doctor and have appointments. This was something my mom knew. She's like, It's absolutely okay to take painkillers. You're facing a lot of pain." It was only after a couple of months where we realized that, the pain is a little more, it's consistent. Maybe it might not be such a bad idea for us to show it to a gynecologist. And that also is something that I will definitely credit my mom for, because today I
Mm.
work, a lot of the work that I do, I work as a project manager for an organization called Girl Effect, where we're conducting sexual and reproductive health programs for adolescent girls and young women. And one of the primary things that we work on are hesitancy to access medical services, right? For however small or big the issue is.
Mhm.
And you will see that that is an issue that is common across, whether you're a younger or an older woman, whether you're from rural areas or urban areas. This idea that
Yeah.
नहीं नहीं ये तो हो जाएगा ठीक, या घर का नुस्खा अपना अपना लेते हैं, is very common. Also because we come from Indian households, not that it's a bad practice, but it becomes harmful when you are hesitant to reach out to a doctor until the very last minute, that there's nothing
Yeah.
else that I know that could help solve this. That is a very wrong approach, and that's definitely something that I will credit my mom for, because mom's like, what, it's fine. It's been a couple of years since you've started menstruating and pain has been persistent. Maybe we should just show it to a gynecologist,
So
which
you
we
were very
did.
proactive, actually, right? By Indian standards, that's like very proactive. Wow.
Yeah. I
Mm.
Today that's how I look at it. I did not think that like at that time, I was not
Mm.
thinking about all of this from this lens, but I reached out to the doctor, and the doctor said that, you've generally been anemic earlier as well, and you're a little weak. And while I do credit my mother for some things, she has to do some mummy kind of thing when you go to a doctor, which is going and telling a doctor, "मेरी बेटी ठीक से खाती नहीं है," and all that. So the doctor's like, let's just give you iron supplements. And she's like, you need iron and B12 supplements for 3 months. And it's absolutely okay for you to take a Meftal spas when you have a painful period. It's absolutely okay whether you take one or even two a day. Kuch bhi nahi hota hai. There are no side effects. And so the doctor's telling me all this because uh, uh, by the time I had reached out to the doctor, I did feel the need to take more than just one painkiller a day. So for me, the way that I see it is it started from the age of 18 and 19, which
Mhm.
was, I mean, I was a little younger. I must be 17, I think. 17, I finished my 12th standard. 18, I was in college. And from then on, and now I don't recall how many times I went back to that gynecologist, but she would always say it would always be this, right? And it was not that I was going back to her every month or something. It might be, I went to her first time and then 2 years after that, I went to her again. And in this time, I was also, after I finished my graduation in Hyderabad, I was traveling. I was in Delhi. I was doing my postgraduate diploma in Delhi.
Mhm.
And painful periods had been consistent. Where
Mhm.
at this time, I knew that I always needed to have Meftal spas on me because my period survival requires that.
Mhm.
Um, Once I take a Meftal, I am functional. But that's how it started. So it started with, needing one Meftal spas only on my second day, which was the most difficult period of my period cycle, the second day,
Mhm.
to requiring two on the third day, on the second day, to then progressing from two Mefta spas on second day of period to one on first day, two on second day, two on first day, two on second day, two on third day. And this
Mhm.
is not a progress that happens month on month, right? It takes 2 years, 3 years, 4 years. I mean, cut to from the age of 18 to now, I was 25. And for me, there had been times where my second day and third day over the last few years also had rendered me completely useless. Like even having a Meftal spas was not helpful enough. I needed to lie
Mhm.
down on the bed and I could not do anything else. Um,
Okay.
by the time I was 25, 26, I started fainting. There were these episodes where I started fainting on my second day of the period out of pain. By
Wow.
the time I was 26, and I remember this very clearly because lockdown had just been implemented. It was March. I think lockdown had been implemented somewhere around 20th, 21st, and it was somewhere around 22nd or 23rd of March. And I got my period, and I remember I woke up and the pain was so horrible that I had to crawl. I very literally, I all my fours, like on my hands and knees, I had to crawl to the washroom because I couldn't walk. That's how painful my period was. And I just couldn't relieve myself. I was like, is it because I've just woken up and maybe I drank too much water and I didn't pee for a long time? Is that why?
Mhm.
Maybe I should go and relieve myself. I crawled to the washroom and I relieved myself, but the pain was so bad, I just fell on the floor. And that was the first time, and lockdown had just been implemented. And I was like, call the doctor. I don't know, call someone. Just do something. And my mom's like, lockdown's been implemented. We can't take you to the clinic. We can't take you to the hospital. Let me just call the doctor and ask her what to give you. And she gave me uh, she gave me a different painkiller, which was not Meftal Spas. I think from then onwards, it just became a norm for me to vomit on an empty stomach on my second day of periods in the initial few months, to faint. I used to initially faint for 5-10 minutes, became 20 minutes. Until I remember, I underwent surgery in September 2021. So, in the
Mhm.
last 4 months before my surgery in 2021, around, you know, April to September, I remember I had reached a stage where I would faint not just on my second day of period, I would faint on my first and second day of period. Like I would vomit on an empty stomach after waking up.
Mhm.
I would somehow crawl to the washroom and I would just faint there after vomiting again. And I think the only image that is it's just an image that I think I will never forget in my life is just me lying on the floor of the bathroom in a pool of my own vomit and urine and blood. unable to move for a good 45-50 minutes and sweating, and my mom's there to able to do absolutely nothing, and I would just pray for, I don't know, I would pray to any and every god in heaven and hell to just make it stop, just do anything but make it stop. That's how bad my pain was. I was completely terrified by the time that I understood that I had endometriosis. And in this while, I had gone back to the very same gynecologist, who then
Mm.
recommended, because I was fainting and I knew that this was not normal and I had to go back to her. And I not only went to her, I went to two other gynecologists in this time, because
Mm.
they had ordered ultrasound scans, and one of them said, you have PCOS. So I still remember for at least 4 to 5 months, uh, between Feb, March, April, 3 months actually. For 3 months, I have lived believing that I have PCOS. So I dug in, because she's like, you have PCOS, you sit and work, it's a sedentary work life, you don't eat well, same things.
Mm.
Ye to hoega hi na. So I was like, okay, at least I now have an answer. Let me go and see what PCOS is and how can I, like, at least I have an answer, right? Now I know what it is
Mm.
that I'm looking for. How can I solve? Like, I need to know what I have to be able to solve for it.
Mm.
Now that I knew it was PCOS, I just dug into research. I was like, okay, there are 4 kinds of PCOS. This is what happens in this, because I'm like, I'm looking at PCOS symptoms and I'm like,
Mm.
I don't have facial hair growth. I am extremely thin, if anything. So, which is again inconsistent with PCOS. So, I'm like, okay, maybe, I have this inflammatory wala PCOS. Jisme you can be thin also and you can have it. And I'm just doing all this, reading research paper and reading stuff online. Maybe that's why. And then I started cutting out coffee. I started cutting out different things from my diet, because I was like, and I
Mm.
started adding other supplements, because I'm like, there's a definite problem. I'm also having like pain in my knees and all of this at the time. Like I underwent another round of tests. My vitamin D was deficient. My vitamin B12 was deficient. All of this, which was at the time very consistent with the PCOS diagnosis. And so I was working towards that. Except after
Mhm.
3 months of reading about it and researching about it, I realized that there is no way I have this, because uh, when I fainted again, there was a pause, I think, for those 3 months when I cut out coffee. And I was like, okay, maybe something is working because I'm not fainting on my period. It's painful, but I'm
Mm.
not fainting. And in my head, I've decided that that's a eureka moment, that I'm not fainting, even though I'm still feeling the same amount of pain.
Wow.
But when I fainted again, and that time it was so bad, because this time I didn't faint for just like, I mean, I was not lying on the bathroom floor for just 20 minutes, right? It was a full hour, probably more. I mean, at that time I was like, yeah, death would be better with than having to suffer from this kind of pain. But yeah, that's that's when, I mean, going through different doctors and reaching out to that podcast, that a lot of my work that I did, because it's digital only,
Mm.
work that we do at Girl Effect, I had started using social media a lot. And once I started using social media, I realized that I was stumbling upon a lot of, and through my research, I was stumbling upon a lot of work that was happening in the space of women's healthcare.
Mhm.
And somewhere through Instagram, I stumbled upon a podcast. And in the podcast, there's this girl talking about how painful periods is not normal. And yeah, I mean, by the time I reached the third gynecologist, who said that, yeah, you do have endometriosis, but there's no way, like, because all your other things are normal, because she ordered another ultrasound. That ultrasound came clear, even though it had some cyst or whatever written on it. She's like, it seems like, because everything else is normal, my only conclusion can be that you have endometriosis, but there's nothing we can do to treat endometriosis except give you birth control. But I don't want to give you birth control pill right now, because you're in between your 2 COVID doses of vaccination. So I had only taken the
Oh.
first dose of COVID, and she didn't want
Mm.
to put me on birth
Uh,
control for the second dose. Somehow, before I had to undergo the second COVID vaccination dose, I had undergone another period cycle which was very similar, and I was really at the edge. Like, I by this time I was living in fear that period pass aa raha hai, period pass aa raha hai, kya karungi? Oh my god. I
Hmm.
mean, I'm living in absolute abject fear, and I'm
Uh-huh.
reading a lot about it, right? By this time, I have already started researching endometriosis. I've come across this podcast in this time where this girl is talking about painful periods, and she's talking about how she found a doctor in Bombay, and how many women who have endometriosis end up having to undergo multiple surgeries. And because, doctors don't know enough about endometriosis, they're performing wrong procedures like, I mean, it's called a laser removal. So it's laparoscopy, but they just sort of remove endometriosis superficially using laser. And she's telling me about all of these techniques, and she's telling me about how most of the women she knows and how she herself had
Hmm.
undergone, I think this was her second or third surgery. And I am like, just thinking about surgery at that, like, imagine this is someone who is thinking that medicine खा सकती हूँ कि नहीं क्या. So you're coming and telling me surgery, I'll have to undergo a
Surgery.
surgery.
Hmm.
And I am terrified. I'm like praying that, oh my God, I hope it's not endometriosis. But then I dig more deep and I find these doctors, there's very few of them on social media who are, they call themselves endometriosis experts, and they're talking very actively about how the medical community, the gynecology and obstetrics community, not just in India but across the globe, refuses to
Hmm.
understand the fact that endometriosis needs to be treated as a specialty of its own. It cannot sit under
Okay.
gynecology. It is not a reproductive
Oh, okay.
disease.
Yeah.
Oh.
It happens there, but like Dr. Shravanthi said, and she said it so well, right? Like, endometrium is your lining that sheds every cycle as period, but endometriosis is not the endometrium. It is lining that is similar to the endometrium, that possibly performs similar function, but it is not the same thing. And because it is not the same thing, that means this is not a reproductive disease. And I remember from the Bombay doctor, I had in fact booked, my surgery date was booked with the Bombay doctor after I blocked an appointment with him. We did a Zoom call, and he said, you'll have to undergo an MRI. And just the MRIs felt like a very big step at that time. I remember when he said you have to undergo an MRI for me to know what it is. I My mom was like, "Are you sure?" I feel like people are my mom was also not convinced. She was like, "Do you think we're making a mountain out of a molehill? MRI is a huge deal." And I'm like, "I know." And even I was scared. And I remember I waited on it for 10 months. He wrote me a prescription, 10 months schedule, 10 days. He wrote me
Hmm.
a prescription. And even for 10 days after he wrote me the prescription for the MRI, I didn't really go and do it because I was like, I don't know. I don't know. But then that fear that my next period is going to come, I was like, you know what? It's fine. I mean, at that time, I thought was MRIs are so expensive. It's going to cost me like 10K to
Hmm.
do this. Should I
Mhm.
really do this just on suspicion of something that it could be? I don't know if this is what's needed for it. But I was like, you know what? It's fine. 12 or 13 days after he wrote me the prescription, I went, conducted the MRI, sent him the files digitally. They're called DICOM files. Um, all of these things that I'm so well versed with right now, right? He's like, you need DICOM files.
Episode, we'll also be like, yeah, this is, we know what you're
Yeah.
talking about.
Yeah, I was like, what are DICOM files? He's like, I can't read it through. Like, you can't just hold that MRI film against the window and show it to me. You're going to have to send me a copy of what's on the CD, which are
Mhm.
DICOM files. I need to be able to pull it up on my computer to read it properly, which he did. And then he
Hmm.
spent a good 1.5 hour on Zoom call explaining to us that, and my mom was sitting there. And he's explaining to us that your daughter has the most advanced stage of endometriosis. In fact, it's so advanced that it's not the case that she will die if I don't perform the surgery immediately. But if you don't perform the surgery immediately, it will progress to a part where she might have to undergo resection, which is where you cut a part of your organ. because endometriosis has grown that much. So he said, and it's so funny, right? He said, what your daughter has is called kissing ovaries and chocolate cysts. I'm like, Valentine's Day, kya? It's like, why are these things called this? But and then he explained to me that kissing ovaries is probably the most as advanced as endometriosis can be, because it means that your uterus, which is supposed to have two fallopian tubes like that with your ovaries, because of adhesion and because of this extent to which the endometriosis has grown, has come so close that both your ovaries are kissing each other. That's like what happens with endometriosis is that it works like a Velcro because it's growing outside of your uterus. It sticks to the other
Oh,
organs. And it sticks to the other organs in a manner that, like a Velcro, and then it's just pulling, it's called a frozen pelvis, which it basically means that everything inside your pelvis is so badly stuck to each other that it's frozen. It's not moving, which could be the reason why the pain is manifesting in your legs, which could be the reason why you're not feeling like you're as flexible as you used to be earlier, and so many different things. And I am, after this call with this Bombay doctor where he's explaining all of these things, and he says that, I feel that she already is at a stage where we might have to cut out a part of her rectum and everything. I'm scared,
even as
and
I'm listening to this, I'm just like I'm just sweating. I think like my back is like. I mean, this must be so scary. I mean, from coming from a place of like, oh, you maybe have PCOS, cut out coffee and your life will be good. Cut to like a month, 2 months later, you're like, actually, we may have to cut a part of your organ. Like, एक second, like, wait a minute, what just happened? Okay,
no, but
sorry to interrupt, but it's
no, it
just
was
like,
exactly
yeah.
like that actually. I mean, today I speak about it so normally, right? I'm just like, हाँ ठीक है एक fallopian tube उड़ेगी ना मतलब. But now, I mean, at that time it was very, very scary. Not that it's less scary now, but I mean, I feel more equipped today. That's the only difference. But coming from having booked the surgery in Bombay to before going, I was still so afraid that, at least maybe if I find someone, because the doctor in Bombay quoted my surgery to be around 9.5 10 lakhs. And my insurance can only cover so much. Even if my insurance covers the full 5 6 lakhs that it's talking about, 4 lakhs is a huge amount for me to be able to pay. It's not a joke. And I'll be in a whole different city, and only my mom will be able to travel with me. And I'm imagining my mom feeling one scared for her daughter, and then where will she do, running around the hospital for insurance, because I know how insurance works. It's not easy, and I'm not okay with how this is all panning out to be, and I'm still researching. And we were to fly out, I remember, on Monday, and on Saturday I had booked myself an appointment with a doctor in Hyderabad. And I was like, what, like last try, let me see. It was with this Dr. Vimi Bindra, and I am based out of Hyderabad. And I wanted to speak to her because by now I had read research papers. I had gone and watched surgeries online. Like, I've spoken to people online. I've done an insane amount of research on endometriosis, because I'm convinced. I mean, at that time, no offense to you, Dr. Shravanthi, I did not believe the medical community. And I was like, I know whether this doctor is going to be equipped to deal with what I have or not. And I will decide that. So I
Yeah,
wanted to go and speak to
definitely.
Bindra
Yeah.
myself, see what her approach is, how she will treat it. And I spoke to Dr. Bindra. I also spoke to Dr. Madhavi, who's a radiologist here in Hyderabad, who was able to detect my endometriosis on an ultrasound scan.
What?
That's
Uh,
all it took.
yeah. And I was so angry at that time, because this was my third or fourth ultrasound scan, and I was like, are you really telling me that this could have been, if there was a qualified person who was
Okay.
taught how to read endometriosis on scans properly, I would have known about this like a year back. I was furious, but I was so in awe of this doctor who was able to just put out like an elaborate report of exactly what places my endometriosis is, what areas it is in. And like Dr. Shravanti said, your scans will, I mean, one, of course, you need a very, very experienced and expert person who knows how to read endometriosis on scans to do this, and it's called Enzian classification. So they basically use something called the Enzian classification to map out where your endometriosis is, but that is still
Mhm.
not a confirmation of whether or not that is an endometriosis. After that, you undergo your surgery, and then there's a biopsy that happens, and only after that biopsy is when you get a
Mhm.
confirmed diagnosis that yes, this was endometriosis. Which is why, people say that laparoscopy is the gold standard, like surgery is the gold standard for diagnosis. Because in extreme cases, there are endometriosis that can't be picked up on an MRI as well. Very few, I think, as far as I've read, but that is something that happens. And when I met Dr. Bindra after meeting with this radiologist, Dr. Madhvi, and this report and ultrasound scan, I went to her, and one, the difference that I noticed was the surgery in Hyderabad was far less cheap. It was quoted at 7 lakhs, not 10 lakhs. It was in Hyderabad, which is my hometown, which means my mom would have support while I'm in the hospital undergoing a surgery.
Mhm.
And she also suggested that I might not need a radical procedure, even if my endometriosis is far advanced, which gave me some sort of it was calming in many respects. And Dr. Bindra was also one of the first doctors who, as soon as we entered with my mother, spoke to her that, you have to listen to her. She has been suffering for the longest time. The mental impact of what she's suffering through is something you do not understand right now. Because there was a point of time where even my mom was like, stop Googling, stop doing this, stop making out to be bigger than it is, because my mom was not able to
Mm.
help me out. And she thought that I was just getting pulled into this very dangerous place where you're Googling your symptoms. But I mean, I loved Dr. Bindra for that. To this day, I just tell her that, she just stopped, like she stopped my diagnosis and she turned to my mother and she's like, you need to stop doing that. You need to listen to your doctor. She's not making a mountain out of a molehill. She's suffering a lot. She's The mental impact of what she's been going through is going to stay for even after the surgery. So you need to be supporting her through that phase. And
Mm.
damn, I really loved her for it. And when she asked, when do you want to do this surgery, she only performs her surgeries on Tuesdays and Saturdays. And I knew this because she told me this at that time. And I was like, no, 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 please, please, before next Saturday, मेरा period आ जाएगा, please उससे पहले surgery कर दो. Like that was the stage that I was in. Like, please, please don't make me live through one more period. I will not be able to bear it. Please just perform the surgery. And she saw me and she's like, okay. And she told her assistant, and they blocked out a slot on Thursday, which is not her surgery day. And yeah, the next Thursday is when I underwent surgery for it. So that's a long
Thanks so
story.
much. Thanks so much,
Sorry.
Medha. Like, I
Yeah.
think in the beginning when we were saying that, yeah,
As you
sorry,
rightly said, the first thing always we have to, look at the history of the person, whoever has this kind of, symptoms presentation. And you very well said that, like, especially women who never had it in the beginning, but it is progressively worsening. That is a hint that it could be endometriosis. So these kind of things should not be missed, definitely. And seeking healthcare opinion is a must. I would say it is better. I mean, most of the times, even our own family members also tend to kind of, like as she said, that they also actually they do it with certain amount of concern only. But yeah, but I think it impacts us in a different way that nobody believes us what we are going through.
can I add that it's so vividly how you described, and that's super helpful for me, and I'm sure to all the women who listen that, yeah, it's put so beautifully, like the scene you say where you're lying and you're in pain and in your vomit. I mean, because frankly, it's so tough for us to imagine the pain, and so thanks for being so honest and how the words you've described it with. Wow, like
Yeah.
really powerful. And I sort of said, like, I'm sweating. Like I take a Meftal fast like this, so I'm like I would have been having 10 from what you're describing. So, yeah.
So, Dr. Shravanthi, I have a question for you. One of the things that I was reading, and I don't completely know if it's correct, but just about how much is spoken about endometriosis in literature, like when you are studying about it, that there is a gap in terms of how much is spoken about its diagnosis and just how much it impacts the women. Can you share a bit more about, I mean, how, like, just from a healthcare learning point of view, like how much is it spoken about, or in terms of like doctors receiving medical training about it? Are there gaps, or what does it go? I mean, just curious to know on that
See,
front.
currently, I would say as of now, it is not about, having a gap in the education. Definitely, during our post graduation and all, we are specifically taught about it. And, but yeah, surgically, definitely, it is not, an easy job. I am a cancer surgeon by profession, but even cancer surgeons dread operating on endometriosis. Okay, because it is so bad, it is such a bad condition, like I just mentioned about how the endometriosis behaves, right, the tissue lining and all. So what
Mhm.
happens is when they respond to the hormones, they bleed, right? So anything that is bleeding inside our body is like an injury. So what our body does to an injury is it tries to heal. So when that healing occurs post the bleeding, the body kind of, there is a fibrosis. Okay, so that is what plasters the organs together. So this plastering is so tough in endometriosis that the you adjacent to uterus we have the urinary bladder, we have the rectum, or where the stools are passed. So all these organs are stuck together, and literally to have the surgery to specifically remove what we want to remove, the endometriotic test, it's a very tough job. So definitely expertise,
Mhm.
for that expertise is required, which is gained with certain amount of experience, work experience in surgical field. So it is not an
Mhm.
easy job, but yeah, awareness wise, or treating the medical conditions wise, now it is not like the older days where the gynecologist would just say that okay, go take a Meftal spas. People are very much, at least in my knowledge, I'm not sure, like as Medha is saying, there could be some possibility that it is definitely happening. I don't want to say that it is not happening. It is good to be aware, and it is good to seek help when you definitely feel so. Women should be aware of this condition and what particular things to be noted, the symptoms and how it presents. This kind of education will definitely, and I think it should start from the school itself, maybe from our secondary school, so that the girls are actively aware of this condition, rather than
Mhm.
like I'm in a medical field, so I got to know it during my MBBS and all. Otherwise, if I'm not experiencing, I'm not aware of it at all. And I have seen my friends also as well who had this kind of presentation. They would be just fainting on the first day of the periods, but we just don't suspect it at all till the time we reach the final year and we actually read about all these things. So
Mhm.
yeah, so education is must, I would say. In as per the medical field, I don't think so there are any learning gaps. Okay, only the gap I would say is the expertise in doing these particular surgeries.
Okay, okay.
So if I might add a question there a bit more on than because from what I am understanding from endometriosis, what you're saying is that there are gaps in terms of diagnosis, treatment everywhere, right? In terms of science. And we more in terms of like how can maybe guide patient and in particular women better. Because
Yeah,
I don't,
sure.
I mean, Medha will also add to it, but in the sense it feels like that there's lesser diagnosis technology
Hmm,
available, less treatment,
hmm.
but there's not, of course, proper guidance, right, in terms of what a
Yeah,
ultrasound can show, not what a MRI. Yeah. So, yeah.
yes.
The first thing is we have to listen to the woman. Okay, the whole story from the time their menstrual journey starts. That is the first thing.
Hashtag
That
it's not in our
itself.
heads.
Yeah, yeah, definitely. And that is where the clue lies also as well. The 90% of the clues are there itself. The rest is only supportive evidence, I would say. And that supportive evidence may not always be supportive, because as I said, it is not always possible to see an endometriosis only on ultrasound or an imaging. Sometimes there could be just patchy endometriosis, and it is a condition where the symptoms do not correlate with the kind of or the extent of the condition, per se. So it is not that only if you have big endometriomas or chocolate cysts, then only the symptoms will correlate, to the kind the woman experiences. Sometimes it could be just, frozen pelvis, which may not be visible as such on any ultrasound. It is only through laparoscopy we get to see that this kind of condition has already worsened to that extent. So so definitely, what a woman gives history from the point of the time her menstrual journey starts, that is
Mm.
in itself is only the 70 to 80% of the clue. Okay, based on that, yeah, they can be kept under constant vigilance and constant monitoring. And there are now medications also to support, so that this condition doesn't go to the extent of severity if diagnosed early. So hormonal treatments are available for that, to control. It is not curable as such, but the condition can be suppressed. And such individuals are encouraged to to finish their journey of childbearing also at a early age as possible. It is not like you have to get married or you have to have your children early, but if possible, to consider it early would be the best, because pregnancy also again has a suppressive effect on the condition of endometriosis, because of the progesteronal hormonal effects. So this endometriosis is seen where there is excess of estrogens. So progesterones are like anti for the estrogens. So pregnancy is one thing that helps. And there are, as I said, hormonal treatments, and surgery is another mode of treatment where we remove the amount of endometriosis, we reduce the burden of the disease, but recurrences are known to happen, because the process by which this condition happens, there are multiple theories quoted, based on immunological changes or inflammatory changes, environmental effects, pollutants,
Mhm.
what we are eating, all these things. And certain genetic factors are also linked with it. And some women do have certain abnormalities of the development of the reproductive system. So in those women also, the incidence of endometriosis is found to be on the higher side. So these conditions can be diagnosed, if they approach the healthcare professionals earlier when evaluated.
Medha, would you like to add to that? Like how you think, like now in retrospect, the doctors could have guided you better, right? Let's say the specialist wasn't there to see the scan and pick it up, but what I heard from you was they could have still guided you better, right?
Yeah. Um, Actually, coming from a purely patient perspective, and it's not that I'm disputing what Dr. Shravanthi is talking about, but I mean, I today I'm a part of an endometriosis support group for women in India, which has over 120 women on it. And in addition to that, there are many others who I've spoken to as a consequence of my Instagram
Mhm.
activism that has happened. Uh, a lot of times the symptoms of endometriosis manifests in other places or in other ways, right? Which means that there are some cases where women might be going to a different specialist and not a gynecologist. Which even then, I
Okay.
would still say that even other specialists, if you have an MBBS degree, you should be knowing if what Dr. Shravanthi is saying that this is something that they're being taught about. Even other specialists should understand that it's endometriosis, but they
Mm.
start looking for things that they know under their specialty. For instance, a lot of women who have endometriosis will more often than not end up having a lesion that is close to their rectal canal, your rectum or your rectal canal, which is where
Okay.
basically the last canal where you pass your stool from, right? And because of that, many women will be suffering from constipation. So a lot of women
Okay.
at many times are going to or either constipation, or they're just like in general being gassy a lot, having alternative instances of diarrhea and constipation, so they're probably going to a gastroenterologist or a general physician, right?
Mm.
There are other women who are presenting with no symptom during periods of pain, but they are presenting symptoms with painful sex.
Mm-hmm.
um, and so these, and with sex, of course, there's like a whole different gamut of issues involved, because there's stigma and taboo, especially if you're an unmarried woman who's sexually active. You are all the
Mm.
more thinking about going to a doctor and talking about this.
Yeah.
So there's these kind of issues which is probably taking women to different specialities, and those specialities then start evaluating this from their perspectives. So I think there's multiple things that are involved here, right? One,
Mm-hmm.
even under those specialities, doctors should be able to understand, if they should be able to take the full picture. What time are you noticing, around what time of your cycle is, they should be able to understand whether it's happening, whether it's something related to their cycle or not. And let's say, even
Mm-hmm.
if they start evaluation from the perspective of their own field, and they have ruled out everything else, or in the process of ruling out everything else, ordered a similar kind of a test like an ultrasound, one thing
Mm.
is, why are radiologists not trained to pick this up? An ultrasound should be able to pick this up, right? But
Mm.
most radiologists that I have met, and I've met more than one, and I know many women on my support group who've met many radiologists, are not able to pick it up.
Mm.
Forget an ultrasound. They're not able to pick it up on an MRI. So that's a very big gap that I see as a very glaring gap, at least when it comes to diagnosis. But the second
Mm.
part is also that even if this is going to two other specialities, doctors should be able to verify at least at a later stage, if not the first stage. Because if your
Yeah.
patient is coming back consistently with a complaint of constipation, and you've ruled out everything else, you've changed her diet, you've given her medicine, you've done everything else, but she's
Mm.
constantly coming back with an alternative cycle of diarrhea and constipation, then what could it be, right?
Yeah.
Why is it getting missed? So I think there,
Mm.
there are certain questions that I feel like the medical community still has to answer, or to, medical community still has a long way to go when it comes to diagnosis. I mean, this is not an Indian statistic that,
True.
it's a global statistic
True.
that it takes
Yeah.
7
Yeah.
to 12 years on an average for diagnosing endometriosis.
Yeah.
Why?
Yeah.
It's actually pretty
Yeah.
simple if you think
Yeah.
about
Yeah.
it. Now that I
See, I
know,
would like to add one thing there. Like, as you mentioned, see, ultrasound or radiology cannot always, diagnose endometriosis. I'm sure you're also aware of that. So, invasive, when it comes to invasive procedure, we can't subject every individual to, diagnostic laparoscopy. So, probably that is where sometimes the delay in the diagnosis or labeling someone as endometriosis, kind of happens. But that suspicion should always be there in the mind whenever this kind of presentation, a woman repeatedly coming with pain or the associated symptoms along with that. So that is one point I would like to add.
Yeah, I think there is a point of where the condition is today and how well the systems, both device and education slash awareness, is there to detect it early on, and then in a way where the world should head. I think the conversation today is that, like, given
I
so
think
many women are,
education needs to be on both the sides, both the patient
yeah,
perspective and also for the doctor
that I
perspective.
would completely
Definitely,
agree with.
definitely.
yes, yes,
Yeah.
true, true. I mean, I think like that. I think what we spoke about today is just, I mean, also at homes, of how much we are taught about normalizing pain, and or just going through it. It's almost considered a rite of passage for women if you are able to endure more pain. And the crisis that Medha was mentioning, oh, why am I the only one taking painkillers when everybody else seems normal? And so definitely, I think these two, and given the so many women experience it, and if you and this was a new information for me, partly that this is one of the condition, like it's like one of the top conditions that affect women, like not just like the gender, but like just when you look at all the conditions that affects the population, it's one of
It's
the
the
top
same
conditions.
amount as diabetes.
It's the
That's
same
so
amount as
much.
diabetes.
Yeah.
Yeah.
And like how much
And the
research is
amount of
put into diabetes, right?
yeah,
Crazy.
research and awareness has been put into there, and clearly I think the call is that how do we head there, and of course with the current, I'm sure there are gaps, and there are things that are happening well, and the doctors, and I'm so glad that Dr. Sravanthi joined this conversation, because we always like find like gynecologists on the other side of the table, and now it's so like just nice to have you on the same side of the table and like talking about it, and it's like wonderful to have that space where we really want to like advocate that more and more women are experiencing it, and if the count is the same as diabetes, then we definitely need more conversations to go. Better devices, like maybe more medtech devices, like more like
Lot
like
more
ultrasounds,
funding
which
for
are
research on women's, ailments that are only related to female bodies. A
yeah
lot more
yeah
funding, because I think that's one of the
yeah
glaring areas that I see where
yeah
there's just no funding
I'm
available.
I'm quite excited about I mean just like a bit tangent, but just like the ability of AI or ML models to be able to pick up on some of these things, the way we are looking into
Yeah,
breast cancer diagnosis, and the startups that are doing, just being able to do some thermal
yeah,
scans and picking up early on. If you are, because it's as a model or as just as a tech, it has the ability to really like take on like large scale of data and bring out patterns, and then train models better to detect early. And I guess we just need to put in resources to do that, and I'm sure that eventually we'll get to a place where we'll have models which will pick up the patterns much early on than they do right now. And yeah, so more work to do for engineers. And if you're a women engineer, like even more work to do.
yeah, a lot more. Yeah, I would stress on that actually. I mean, as long as there's women in the rooms, um, yeah, engineers or not doesn't matter actually.
Yeah, yeah,
Yeah. Yeah, I think we've already recorded for a long time. This was so powerful. That's the word for me. Like Medha, so amazing you're sharing this. I'm sure like all the thousands or even if 10 women hear this story, they'll be so moved. I'm, Thanks so much again.
Thank
Uh,
you.
and Dr. Savanthi, of course, thanks a lot to you. We are so happy you're opening up this conversation. Love the exchange between you both. Could have hours of it. And yeah, we think this is the way forward to build better systems, to build better health for millions of women out there. And so, yeah, we have less pain, both mental and physical. Yeah, thank you so much.
Anything, any concluding thoughts that if you either of you would like to share, then we're happy to.
Yeah, I think at the end, the only one thing that I'd like to share, especially for women who might be hearing about this for the first time through this podcast, is don't be scared. The story is very scary, and I fully agree to that. And it has been very scary, but look at, I mean, I would just say, look at where I am today, where I'm able to share this so easily with. I think one of the reasons, that I am able to do that is that we just have, and I don't know where we get it from, but we just have some immense source of strength that we are able to come out of things and just be there for each other. And if women don't do that for each other, then no one else is doing it for us. It's not a woman's world. So, which is why I'm here today doing this podcast. And however scary that this may sound, take it one step at a time. There are resources. Look for the right kind of resources and the right kind of people who'll support you through this. And it won't be so scary then anymore. And you'll be able to face this. So, yeah, just that.
Thanks so much for running the community that you run with this 120 women who are experiencing it. And that sounds like an
I don't
amazing
run it.
initiative.
I'm a part of it. But yeah, if there's anyone who wants to know about it, I can put them in touch for sure.
Yeah, we can link it in the description. Yeah, sure. Yeah.
Yeah, I think you're doing a wonderful job, Medha. Definitely. I think this was very much needed.
Thank you so much, Dr. Shravanti. And no offense, sorry.
Yeah.
Like, I am very,
No, no, no,
I'm
not
very
at all.
aware
See,
that of course if someone
this
is
kind of
like,
things keep happening. It is good to know what, patients think about doctors. See, that
yeah,
there
I mean,
gives a
personal
scope
experience
for
is
our
shape our
improvement also.
experience.
Yeah, yeah, definitely.
Yeah,
See, I have been on that end also, so I have learned a lot of things when I was on the, patient side, even after being a
yeah,
doctor. So a lot of things changed
I
within me when
understand.
I was on that side of the table. You
I
develop
completely
empathy.
understand.
Yeah.
Yeah.
So first thing is I
Thank you
think
so
we should
much, Aditi and
empathize.
Saraswati. Yeah.
Yeah.
No, absolutely. Actually, that's where this is all coming from also. So yeah, thank you so much, Aditi and Saraswati, also to sort of make this happen for other people through your platform, which is a very, very important one. And just one last thing, it doesn't end with surgery for us. There's a whole
Right.
phase of post-op that I didn't even talk about. Like we covered about a lot of things, and I know Saraswati, you and I discussed this on call the other day. But my journey with endo didn't end with my surgery. There was a whole lot of other things after that, like physiotherapy and everything that came with that, and my experience with hormonal pills that doesn't get covered because most of the time awareness is only such a huge gap that people just that यही सुन के इतना सारा हो गया.
Yeah. Yeah.
Whether you want to do like a part two, I mean, if you have space for it, or if
Sure,
I can
sure.
take
No,
it.
definitely. I think we also need to, I think, speak about insurance and how, like, because I think a lot of those things also make these things mainstream. Like, if you're having help and having coverage, your ability to take actions for these conditions, like, really increases. But, yeah.
I loved your point about MRI. That's super, like, God, it's interesting. Like all these, sort of say, like the mental barriers we have to things, right? And it's so
Yeah.
important to, yeah,
And
no.
Aditi, I am a working professional. I have
I know.
6 years of work experience. I stay in a metropolitan city. I am an earning
Yeah.
woman. Uh, I am educated. I'm a third generation educated person. And for me, if that mental barrier is that much, and not just for the financial part of MRI, right? It's just for
Yeah.
what it is. So just imagine how it must be for other women. And yeah, and
Yeah.
of course, insurance will cover the other aspects of it also because 6 lakhs, 10 lakhs, मतलब मेरे लिए भी बहुत बड़ी बात है यार वो
Yeah.
ऐसे नहीं
Yeah.
ऐसे पैर पे नहीं उगते ऐसे पैसे से जाके तोड़ के और
Yeah. Yeah. Absolutely. I completely relate with you on the MRI when I had to get one done, and then I was just like, okay,
yeah,
uh, yeah. I
it's
mean,
just
yeah. Cool.
One episode just on MRIs. Wow.
One episode just on MRI.
we'll cover that in the
Yeah.
next. Maybe the
Yeah.
second episode can be about more handy logistics of things that are helpful for people to plan
Yeah.
their actual treatment. If
Yeah.
that's
Almost a guide for them. We
yeah,
can
like a
say.
guide.
Yeah.
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 But thank you
Wonderful.
all.
Thanks.
Thank you, Dr. Shravanthi,
Yeah.
also.
Thanks so much. Thank Dr.
Yeah,
Shravanthi.
thank you.